I'm Lindsay Harriet. I'm 39. I have two little boys, 2.5 and 6 months. So I was pregnant with my first, and everything was totally fine throughout my whole pregnancy. Like a few days after I'd given birth and was home, I started having just like chest pain and heaviness and like short of breath, all those things. And then was just kept being told I was anxious and I'm a new mom, so that's why you can't sleep. And finally, probably a week after I'd given birth, I ended up at urgent care because I was like coughing, like I really couldn't breathe. And I got sent to the ER with like a blood pressure of like 200 over something. And I was having like backup of fluid into my, I think, lungs. Lindsay and I met when she was readmitted to the hospital after a normal pregnancy. She had come back with postpartum preeclampsia and severe mitral regurgitation, leaking of one of the valves that caused backup of fluid, like she said, into the lungs. We worked to diagnose the valvular heart disease and then to treat getting fluid off the body, reducing the blood pressure, and had her feeling better before she went home that first time. With my second baby, I got home from the hospital and I was feeling short of breath. And I'm pretty sure I called or messaged you guys at like the middle of the night one day because I would lay down and I was like, I can't breathe. This is exactly what happened last time. And then your nurse called me at like 8 a.m. and was like, go straight to the ER, like, don't pass go. And it turned out that time I had a pulmonary embolism and postpartum preeclampsia. We made the decision not just to assume this was blood pressure issues the second time, but to say, let's start from scratch and make sure we take off the table the other scary, life-threatening type of things that can happen to cause chest symptoms after a pregnancy. And lo and behold, she had a different thing. Yeah. Pulmonary embolism happens less frequently, but still happens. Heart disease after pregnancy in general is something that women aren't necessarily prepared for. You don't hear about it. There's not a lot of education about it out there. Almost 10% of women have a hypertensive disorder around pregnancy. People who have preeclampsia have a higher rate of long-term heart disease, higher rates of heart attack, stroke, heart failure than their counterparts who had normal blood pressure during pregnancy. So how we can identify and refine that risk over the coming decades and as early as possible so that we can keep Lindsay and all of Lindsay's peers who have had preeclampsia healthy and robust and able to take care of their kids and their grandkids and go to their weddings decades from now without cardiovascular disease is our objective in the postpartum hypertension clinic that I run and our group at Northwestern in the Women's Heart Care Clinic. Once I met you, I felt very much like I was being taken care of and the whole picture was being looked at. The fact that they called me at like 7 a.m. to tell me to go to the ER, I feel like most doctors you don't hear back from for like 48 hours. I felt very cared for. And then when I was in the ER, the like on-call doctor was like, your cardiologist is on it. We'd already gotten notes. We're like, as awful as it all was, it was great. Lindsay is an extremely resilient and dedicated patient. She just told us about these two scary admissions in the postpartum timeframe. One of the biggest starting points is just educating and making everyone aware that this is something that women should want to focus on for themselves as early as you can to live not just a long, but a long, productive and strong and healthy, meaningful life based on good heart health.